Hello everybody. I'd like to talk to you this week about antibiotics, mostly because this is the time of the year where a lot of people are fighting sinuses, allergies, sinus infections, things from the farmers in the fields, all the dust that's around, or the leaves when they're out in their yard. And so many people are experiencing more congestion, more discomfort, which leads many people to their doctor and an antibiotic or an antibiotic regimen like a Z-Pack or something like that. And certainly, antibiotics, their development has been life-saving. Most people have heard of penicillin and how it was a random chance discovery, but it saved literally hundreds of thousands, if not millions of lives. But there's a couple things that people don't know about antibiotics. One is that the antibiotic doesn't go directly to the site. So if you have a sinus infection, that antibiotic is going through your entire body, which can kill the infection, but it also kills off good bacteria in your stomach, which can lead to digestive problems or bloating or acid reflux over time. And also it can make you more likely to get sick again, because if your body doesn't kill the bacteria itself, it doesn't actually create long-term immunity, especially for those people that are used to having multiple sinus infections every year. In many cases, those are caused by the fact that they've used antibiotics on a regular regimen over a period of time. The second thing that people don't know about antibiotics is that they have a high adverse reaction rate. So a lot of times we think of antibiotics like a simple, no problem thing. It helps with discomfort, it helps us feel better faster, and certainly everybody wants to feel better faster, but at the same time antibiotics were really developed for life-saving interventions to only be used when most needed. And what they have is, first of all, besides painkillers, they have the highest percentage of bad reaction or adverse reaction rates of any major drug class. In fact, one of the children that comes in to see us comes in specifically because when she went into her doctor for a simple round of antibiotics because she was congested, the side effect caused severe seizures and put her in the hospital. And so now they get her adjusted and they improve her immune system to help have her have less need for those drugs. But also things like the Z-Pack, which so many people take this time of year because of infection, significantly increases your risk of having a heart attack. And also, anytime you've had more than 2 antibiotics in your entire life, it increases your risk of developing cancer as you age because of what it does to the inside of your body and the bacteria that it kills and the bad bacterial overgrowth that affects so many other parts of your health. And very few people know that there's even side effects of antibiotics. So here's a couple things you can do both if you're sick or congested, and then also if you've taken antibiotics in the past. First of all, if you're fighting off a sickness, a cold, a cough, the flu, sinus infection, our recommended regimen is, first of all, come in and get an extra adjustment. The extra adjustment improves your immune system. It actually increases the amount of white blood cells in your bloodstream, increases immune system responders like serum thiol levels and interleukin-2, which are really just different parts of your immune system to help make you healthier. Along with that, you want to increase your vitamin D. We typically recommend you take between 15 and 20,000 IUs of vitamin D for at least 3 days when you're fighting something off. In fact, there are several natural medical doctors, especially that I read of in the Chicagoland area, that recommend that you can take up to 50,000 IUs. For comparison, when someone's in maintenance taking vitamin D, if they're taking our vitamin D supplement, that's 5,000 IUs. To go along with that, there is an essential oil called oil of oregano that's great for helping your body to fight off infection, to fight off viruses and bacteria, and you can buy that very inexpensively at a health food store. The last thing specifically related to your sinuses is peppermint oil. Peppermint oil is something that you can put either on your skin or on your tongue, and it kind of tastes like you just ate 10 peppermints all at once. But what it will do is it will create drainage in your sinuses that can help with that sinus pain, that itching or that burning, and there's no downside. There's no side effect like the antibiotics. And again, a cost-effective, fairly cheap way to do it, and we do carry that in the office here as well. If you do end up needing antibiotics, if you're severely sick, or if you're just hearing this and you just ran through a round of antibiotics, the most important thing that you can do is take a series of probiotics directly following the antibiotic to help your digestive tract, to repair or to replace the bacteria that's been killed off by the antibiotic. And what's recommended is not that you have to take huge amounts of probiotics forever, but go to the health food store, get one round or one bottle of at least 50 billion probiotics daily and take that for 1 month. And that really helps to make a huge difference. Also to help with the side effects of any medication, but specifically antibiotics, we also recommend that you take a box of daily detox for 1 month to pull the toxicity that those antibiotics have in them out of your body so you don't have residual effects and a weakened immune system after you finish taking the antibiotics so that you can be much, much healthier. So in conclusion, life-saving intervention, antibiotics are great. For simple discomforts and things, antibiotics really have more side effects than they do benefits, and also if you don't know how to take care of yourself, they can have a lot of residual effects. So keep your adjustments, take your vitamin D, do the things that we just talked about, and you're going to have a lot safer and healthier fall and winter season here. Have a great rest of your day.